Canto. I'm going to be a Smart Tool instructor next year in New Jersey and New York City as a physical therapist. We have Jack here as a patient. Jack, can you just tell me a little bit about your right knee pain, if you don't mind?
Sure. It hurts.
No, so what else is going on, though? Yeah, that gave me about 10 seconds of the video, so that's great.
The initial thing, or what's going on right now?
Right now,
it's
yes.
It's sore. Actually, it hurts when I notice, like, if I'm lying on the ground and I try to dig my heel in, it sort of yanks on something. It's not even, it's like here. Like, I definitely feel it here.
Got it.
And only when I bend it past, like, when it gets sort of towards the end of the range, like right about here,
right,
then still, it's sort of like behind. It's not really the front. It's sort of like behind, not the inside.
Gotcha.
Then it goes down here.
Perfect. So Jack's here for me for right knee pain today. We're going to take a look at how we can use the smart tools along with correctives today. So first thing we've noticed is just a positional sense, or just standing. If you don't mind, Jack, just stand up and face that way. Good. Let's step back here. Come on right here so I know the camera can see it. So it's kind of hard to see in this position, but his femur on this side is actually a little bit externally rotated. And his tibia, if you kind of can see, I'm following the tibia, it's going to go into like a little bit of an torquing in motion. So he has got a little bit of torque going on with his knee. That could actually be contributing to a little bit of his medial knee pain that goes possibly a saphenous nerve referral pain, or maybe some pronated issue going on to the knee. So we're going to assess through that, and then we're going to do one test or so that I know might be happening because he might not be able to adduct or interrotate his hip as much, which could cause a little bit of other things. So, Jack, can you go on your left side for me on this table? So lie on your left side. Now I'm just going to do a normal Ober's test to see where I need to actually work his knee. Bring it up, that's good. And just normal Ober's test to kind of see where his hip is able to go for. I'm going to hold his knee here, and he cannot bring his knee beyond midline. So that also means that his hip is not having the ability to adduct, so he can't absorb shock well when he actually goes down or bends the knee. So my goal for this smart tool, or this correction, is to get us getting the adduction going on. Good. Thank you. Hey guys, so let's go into the smart tool release. Because he has difficulty, Jack has difficulty adducting his hip, and also a little bit of extension of the hip, we will be releasing a little bit of his like recthin, along with his like vasa spinalis by kind of working on the fascial area with the IT band. And then a lot of research will say that it's really not the IT band that's restricting everything, or the TFL. There's some research out there that's the capsule, the posterior capsule. So I would probably work on him. I just will do this for today's purposes. And I'll probably work on a little bit of his rectus abdominis because he's a little bit tight and overutilizing it without using his obliques. So for this time, we're just going to work on in here, see where things are. It's a little bit, tone is a little high in the distal aspect. A little bit this way. Got some good stuff this way, actually. Okay, so once I find it, there's multiple ways I can do this. So I want to hold here. Okay, tighten up your quad for me, Jack. Good. And relax. Good. Tighten up the quad. Good. Relax. Good. Tighten up the quad. Good. Just to get his tone down. I'll probably work on here a little bit more. For this video's purposes as well, I would actually get some active range of motion. So extend here. Good, and let it go. Good, extend. Good, let it go. Let it. Good, extend. Let it go. Just to get his stuff moving a little bit more. Okay, other stuff that I'll probably work on is get here to just get the quad active, especially the vastus lateralis region, to relax. Probably posterior little capsule if I have some time, and the rectus abdominis if I have some time as well. All right, so since we finished our releases, feel free to tune into our part 2 where we do some correctives to kind of really stick the correctives better or neurologically for the patient to learn where things are and space. So